Now, not all human papillomaviruses cause cervical cancer. So the ones that do are what are called high-risk HPV. Now, most people won't know that they have high-risk HPV, as it usually doesn't cause any symptoms.
So then, why isn't cervical cancer way more common?
Well, usually being exposed to high-risk HPV isn't actually a problem, and the immune system simply clears away the virus. 9 times out of 10, the body can clear the infection within 2 years. But occasionally the body doesn't, and then that's when it becomes a problem. We don't really know why. Some people can clear it better than others. It might relate to the particular type of HPV that somebody gets, or their immune system, a person's age, or factors like if they smoke. Regardless, it's this persistent infection of the cervix by high-risk HPV virus that causes precancerous changes to the cervix, eventually can turn into cervical cancer. And that process can occur over the course of about 10 to 20 years.
So that means you've got a time window to potentially stop this process, and that's where cervical screening comes in. If you can test the cervix for HPV, you find people who are more at risk of cervical cancer. Now, you can't actually cure the HPV itself, but you can treat abnormal or precancerous changes to the cervix caused by HPV. If you can do that, you can prevent cervical cancer from happening.
Now, most patients prefer a female for the test, so I don't actually do cervical screening, and of course, I've never had the test myself. So I'm going to hand over to our own nurse, Perry, to explain how cervical screening is done.